So yesterday we have discussed what is importance of diagnosis from James Krauss. Then importance of diagnosis from homeopathic perspective, and how it is too important to understand every time. So James Krauss introduction is very much necessary for everyone to go through so that they can approach with a right approach towards the patient. So many aspects he has touched while explaining the importance of diagnosis. First, he has explained we have to differentiate between what is physiologic and what is pathologic. Then he explains that what is the importance of diagnosis in the finding it out, the anatomical seat of the disease. Second important thing which he explains over there, the importance of diagnosis in order to understand the different types of physiological to pathological reactions, right from inflammations and all the varieties of the pathologies dealt with the inflammation. That is the hypertrophy, hyperplasia, atrophy, aplasia, then necrosis, all those things, infarction, ischemia, all things which he has tried to explain, and these are necessary things. This is what Hahnemann explained in third aphorism, the knowledge of disease. This is too important. Unless and until we diagnose, we cannot go ahead. And this is in length he has discussed. And to conclude that paragraph, he explained that it is important from therapeutic point of view also for the allopaths, but for us also it gives you certain hints. It gives us a exactly homeopathic management. And 4 points which he has discussed in order to find it out the etiological factor. He explains over there, you have to find it out whether it is developmental, whether it is traumatic, whether it is infectious antecedents of predisposition, or it is excitation. All things we have discussed in length in yesterday's lecture. And then we have started the therapeutic approach against the diagnosis. And therapeutic approach again depends upon 2 important things. The first is you have to find it out a remedial agent for the purpose of either cure or palliation. And second important thing which he has explained, the importance of hygiene as well as importance of the sanitation in the prophylaxis of the disease. So all the aspects which he has touched in order to understand, and this is what is given in 6th edition of Organon of Medicine. So Hahnemann never said that give only the medicine. Hahnemann said that everything is important. You have to manage the case with all the perspectives. And then we have started next paragraph. And in that paragraph, what he said on page number 7, the treatment of the patient subject to the malformations, malpositions, malnutritions, injuries, foreign bodies, traumatic, infectious inflammations, new formations is effected with medical, surgical, or hygienic means, or a combination of all these given in a patient. So all those things are very much necessary. This is what we have learned in detail in yesterday's lecture. So now there is no need to go over that. We'll start with the next sentence. What he says? He says surgery may remove or palliate the effects of anatomic excess, defects, perversions. If there are any anatomic defects, if there is a cleft palate, if there is a Palot's tetralogy, in such types of cases, role of surgery is very important. Sometimes there might be a very severe tumor formation affecting or obstructing the respiratory tract. If it is obstructing the respiratory tract, the patient is not able to take the breath. It is necessary at that moment to go for a surgical intervention. So sometimes it is very important. Defects and perversions. Yes, defects are also necessary to treat. For example, if there is a malunion fractured, malunion of the fracture, then if you want to make it again a normal, what is necessary is to go for a surgery. It is not a medicine which will going to clear the malformation. So surgery has its own value. So he explains it is not only the medicine or homeopathic medicine will going to clear, but you have to take into consideration the need of the patient. Next sentence, what he says, he looks towards each and every point. Food, water, air, heat and cold, light and electricity, exercise and work, massage and suggestions, as well as glands to replace the glands, vaccines to call out antibodies, and sera to supply the antibodies may remedy or palliate effects of physiological excess, deficiencies, perversions, may restore hygiene and establish the sanitation. See, he has touched each and every point. He has not said just give a medicine. He explains you have to look for the food, how whether the patient is consuming right type of food or not. It is according to his disease or not. It is too important to know. Second important, the importance of water. You must know the relation whether how much water the person can need. If a patient is in a CRF, chronic renal failure, then you have to find it out. You have to restrict the fluids. That also you must know. So everything you must know. If the patient is dehydrated, he needs the water, at the same time the electrolytes. So concept should be very clear regarding the treatment. It is not just giving the arsenic to the patient or giving the belladonna to the patient. It is not the homeopathy. Air, heat and cold. So sometimes patient is in spasm. You have to ask for a proper application of heat. If patient is suffering from rheumatic pains, it is the dry heat which is necessary. If the patient is having pain in abdomen, it is spasmodic. At that time, it is the moist heat which is useful. So you can ask for hot water bath. All those points are necessary. If a patient is having a very severe pain associated with the hemorrhagosis or there is a bleeding inside happening over there because of trauma, it is the cold fermentation or ice cold fermentation is necessary. All those measures are necessary depending upon the situation, what you are treating. It is not a single entity with which you have to go ahead. You have to understand each and every aspect. Then he says over there, light and electricity. Yes, light plays very vital role. If there is a newborn child with a jaundice brought to you, importance of light, you must know. If it is physiological jaundice, the sun rays are very necessary to remove the jaundice, excess of bilirubin. This is too important. You must know the importance of it in the management. Then the electricity. Yes, everyone knows the importance of electricity, specifically whenever the patient is in a suspended animation state, his heart is stopped. To give the defibrillation, use of defibrillation, and to utilize the stimulus of electricity is very much necessary to stimulate the heart. So that is also another point which he considers over there. He is not explaining medicine is the answer for it. Exercise and work. Yes, Hahnemann explains in the fourth aphorism that he should be likewise preserver of health. He knows the things that derange the health and how to remove from the state of disease in the person. So this is very important. He must know the importance of the exercise and work. How much exercise one should go for. What is the importance of exercise? And he should deal with the patient. Tell the patients that you have to go for such and such exercise which is necessary. If you are dealing with rheumatic conditions, you have to ask the patient to what exercise he needs. So physiotherapy always plays very vital role. I used to give much time in order to explain the physiotherapy to the patient. I used to give much time to discuss the importance of the exercise in their daily life. And before that, it is necessary that you must do it. When I say it to the patient, I should do it. That is very important. Then you have that right to say. I used to tell patient that you go for cycling. I used to do the cycling. I used to tell them to go for Surya Namaskar. I used to do daily 88 Surya Namaskar. Once you do it, then you have a right to say, and then patient believes. So importance of exercise is very much necessary to tell the patient. Then about the work, how he adopts the work, what is his behavior, what is the impact of the work on him. All the aspects are necessary, and accordingly you have to tell him. Then the massage and suggestion. What is massage? Massage is a very important entity. Again, a physiotherapy. It is very good for good circulation. a thorough massage always helps in circulating the blood, and it is very useful for maintaining the health. So massage plays very vital role. Suggestion is nothing but the psychotherapy. Suggestions, it is your duty to give them suggestions. Patients never just, they are not coming for the medicine, they require your suggestion. They ask from what disease they are suffering from, and then they expect your suggestions, what to do. They always expect your suggestion about diet, they expect your suggestion about their daily routine, they expect your suggestion about the regular exercises, the physiotherapy, about how to tackle the disease. All those suggestions are necessary, as well as glands to replace the glands. See what he says, glands to replace the glands. This is too important. Glands to replace the glands, vaccines to call out antibodies, and sera to supply the antibodies may remedy or palliate the effect. There are many disorders. For example, if a patient is brought to you in a hypothyroid state and hypothyroidism is so much increased that his patient's TSH level is more than 150, it is not measurable, and patient is in a deceased condition, he is absolutely sluggish, not able to move, and everything, even constipation is marked, patient becomes dull, the body becomes very flabby, edematous, the face is edematous, extremities are edematous, and if the patient is in agony, sometimes it is necessary to utilize the supplementary auxiliary measures. Here you have to supply the thyroid to tackle the case very early. What you are giving is nothing but the supplement, whatever is their part and parcel of the secretions of the body, which you have to provide at that moment. Because to bring him again into normal, along with the homeopathic medicine, then you constitutionally treat that patient, considering his miasm, considering his constitution, considering the whole case. But at that moment, sometimes it requires such types of treatments, such types of supplements. If the patient is in absolutely dehydrated state where electrolyte imbalance is there, it is necessary to give him auxiliary measures in the form of IV fluids if it has been really needed, if patient is vomiting off and on. So these are all things which he explains over there. He never explains give the medicine. He explains over there the antibodies and sera to supply the antibodies may remedy or palliate the effects of the physiologic excess, deficiencies or perversions. Sometimes if there is a dog bite, it is too much necessary that you ask the patient to go for immediate rabies vaccine. You should not deal with the patient's life. It is too important to prevent the rabies, because you know that after once the rabies happens, no one can stop his death. In such types of cases, you have to think logically. You have to understand logically. You have to look towards the patient and find it out the solution. And all those things matters a lot when you deal with each and every individual patient. So what he says, all those things are necessary depending upon the cause, whether it is physiological excess, whether it is deficiency, whether it is perversion, it may restore the hygiene and establish the sanitation. These two words plays very vital role in patient's life. Sanitation is very important, because disposal of waste, unless and until you do, it is not possible to bring the health in the patient and patient's family. So very important thing is that the restore the hygiene. Hygiene is again important, personal hygiene. Person comes to you with a lot of skin problems, and if you observe, his nails are absolutely increased in size, they are full of dust over there inside it. He has not taken the bath even for 3-4 days. Hygiene is important. Your medicine will not going to do. Perversions means perversions in all aspects, Rutuja. Perversions are there with desires. The perversions are there. Person, if it happens many times, that patient gets the free something for eating. For example, a person is hostelite and he gets a free diet, and then he consumes a lot. It becomes a perversion and it affects him. It affects his it affects his harmony, and that reflects in the form of signs and symptoms. Perversions at all level. It might be at the desires and aversions. It might be at the sexual level. The perversions are there, and those perversions you have to deal with the proper medicine as well as with your suggestion. So that those things are very much necessary to deal with. So James Krauss explains the total content of the aphorisms in a detailed manner over there. He explains over there further in next sentence what he says: medicine in the form of medicinal substance may remedy or palliate the effects of etiological excess, defects, perversions, effects which are not remedied or remediable, palliated and palliable by surgery, hygienic or quasi-hygienic measure. What he says over there: homeopathic remedy is one part. It is one part of your management. When you deal with the patient, it is one part. Many things you have to take into consideration. You have to ask accordingly. There was just a call from the Calcutta. One of my avian patient is there. His brother was talking to me. He is judge over there in Calcutta. And he asked, Dr. Saab, I got the increased uric acid and I'm having the very much joint pains. I have seen over here with orthopedician, they have prescribed me, but I'm not getting the result. So can you suggest me any medicine? I asked the just what is your daily routine? And he said that I used to wake up at 10 o'clock in the morning and I used to sleep at 3 o'clock at night. So I said, first change your daily routine. This is too important. Unless and until you sleep before 11 a.m., your biological clock will not going to work. There will be no, what you can say, a filtration which happens in the kidneys, the liver, the detoxification, which runs with a double aspects whenever a person sleeps between 11 to 4. It never works. Automatically, the thing is that uric acid levels will increase. So you have to tell each and everything according to the patient, and accordingly you have to suggest them. It is not medicine which will going to work. And this is what the James Krauss said. So James Krauss introduction gives you a different thoughts that how to deal with the patient. You see, when you go to the allopaths, they deal with all these auxiliary measures along with their allopathic medicines. But problem is that they tells all those auxiliary measures to the patient, but their medicines will not going to cure them. That is the problem. All medicines are only palliative with them. We are lucky enough, we have the curative medicines in our hand. If we rightly, if we are able to get a right case over there and find it out a solution from constitutional point of view, even the disease is chronic, if it is acute, we can find it out acute totality and acute remedy. We have remedies which are there for the purpose of cure. So this is what the approach should be when you are dealing with the patient. And this is what the James Krauss. So James Krauss said, Hahnemann have taken into consideration all those aspects when you deal with the patient. And then he turns to the mesh. There he has used three to four words. Palliable by surgery. One word which he has used, palliable by surgery, hygienic or quasi-hygienic measures. So hygienic means personal hygiene, quasi-hygienic means it's all personal hygiene along with the hygiene of surrounding people. So that also plays a very vital role. So all those things are necessary when you deal with the cases. So whenever the COVID situation was there, we are doing the same thing. It is not we are prescribing the arsenic to the patient. We are taking many cases. We deal with many cases. I have used many times in the ICU also. I have utilized the remedy. The one remedy which worked beautifully to bring the patient out of the ventilator was the anti-Mars at that time. It worked beautifully. So it is impossible. What he says next paragraph, it is impossible to know all the antecedents, causatives of the disease consequence. What he said, it is impossible to know all the antecedents, causatives of the disease consequence. So when you ask the patient, whether anything happened in last 1 to 2 years which has caused you or which has brought you to such a disturbance. And patient says, no, doctor, nothing has happened. Many times you get such answers. So it is not possible every time to get the answer and get the causative factor over there. Patient forgets many times. Patient comes to you at the end. He has consumed lot of allopathic treatment and then he comes after 2 years, 3 years, 4 years, and he forgets what has happened earlier because of which the disease has started. So you never get the antecedent causes. So if it is not known, it doesn't matter for us. This is what he says. Tolecosm is easier than the tolecosm. This is written by Hahnemann in next paragraph. Whenever he starts the introduction, he has written in exclamatory mark. Tolecosm. Hahnemann says, tolecosm. How do you know the cause of the disease? Allopath says they know the cause of the disease. Hahnemann says, how can you say tolecosm? Because you cannot know or you don't know the cause of the disease because disease is hidden in the interior in dynamic form. The cause is hidden in the interior in the dynamic form at the level of vital force, which is not visible to your naked eye, which is not visible to any laboratory investigation, which is not visible even to any MRI or CT scan. And still you say you know the tolecosm, and that's why he says tolecosm is easier said than done. It is very easy to say we know the cause of disease, but it is very easy to say, but we don't know what exactly the disease is. And that's why James Krauss says in a single sentence, tolecosm is very easier to say than done. How then shall we remove or palliate these effects by medicinal substances? Then he put the question. If you don't know the cause of the disease, how can you treat? How can you remove these symptoms? This is the question put by James Krauss. And then he answers in the next line, there is only one way with which we can go ahead. This tolecosm, those who are students, my suggestion is that underline that tolecosm, write beside it. It is a short note topic. Tolecosm meaning is to know the cause of the disease. In an exclamatory mark, when Hahnemann says, he explains how do you know the cause of the disease. So this is the tolecosm is the terminology used by Hahnemann against the allopaths who used to say they know the cause of the disease. And Hahnemann says it is not possible to know the cause of the disease because it is hidden in the dynamic interior at the level of deranged vital force, which is not visible to naked eye or any laboratory investigation. So this is what you have to write it over there, and you have to write it. This has been written purposefully by Hahnemann against the allopathic medicine. What he says, then how then shall we remove or palliate these effects by medicinal substances? Here Hahnemann steps in to say, for the first time in all history, काय म्हणतोय तो हॅनेमनने इथं काय सांगितलं, if you even though you don't know the cause of the disease, first time in the history of medicine, Hahnemann first time says the words which are used are very important. Remove the effects and you remove the disease, the cause of the effects. Caesat effectus caesat causa. Underline caesat effectus caesat causa. 2 marks question. That's the meaning of it is the earlier sentence. Meaning of this caesat effectus caesat causa, MCQ, what it means. Remove the effects and you remove the disease, the cause of the effect. This is the meaning of this sentence. This is the simple thing. This is what we have to do. Patient comes to us with a totality of the symptoms. He comes to us with his manifestations. He comes to us with manifestations with his own state. So we know the symptomatology along with the state of the patient. So we can immediately think over it and we can find it out exact similibum for his totality. Effects means totality, signs and symptoms. Caesat effectus, caesat causa. You remove the effects, you take the totality, find it out, antitype totality in your materia medica, find it out a right remedy in your materia medica, give it to the patient in right potency, judging the susceptibility, judging the constitution, judging the individual, and then just wait for the result. The totality disappears, the patient's totality disappears, and once you remove the totality, the original cause automatically disappears, which is hidden in the interior. And this is what the explanation is of this Cesat effect, Cesat causa. It can be asked as an MCQ, it can be asked as a short note topic also. So both things you have to prepare. For students, it is very important. Two short notes on this topic, Tolle causum and Cesat effectus, Cesat causa. Now he explains the science. What is mean by science? What he says, empiric medicine. Empiric means empiric medicine gazes, recommends, tries, hits and misses, misses and hits again. Empiric means which is based upon experimental thought. It is based upon the just on observation, which is based upon speculation, is empiric medicine. This word he has utilized for allopathic medicine. Empiric medicine is allopathic medicine. How they used to use the allopathic medicine? They prove it on, first they prove it on animals, considering human as an animal. They utilizes the same medicine on human beings, and then there are many effects which happens over there. Sometimes they get success, sometimes they develop lot of problems, and that's why what he says, they tries to do a gunshot therapy. So empiric medicine gazes, it gazes. Gaze manje kai? What is a gaze? To think, just to think. So they think it might work, and then they use this. Empiric medicine gazes, recommends. They recommend, yes, you take this medicine. What he then they tries, hits and misses. So they give the medicine. Sometimes it hits. Sometimes it never hits. It gets missed, and then it misses and hits again. So this is the way. This is with the approach. This is how allopathic medicine works. Homeopathy is not like that. And that's why he compares the allopathic medicine with the homeopathic medicine. Now what he says, scientific medicine. Scientific medicine, he has utilized the terminology for the purpose of homeopathy. He explains first what is scientific medicine, and then he explains homeopathy is the scientific medicine. Scientific medicine, like scientific medicine, does not gaze. There is a difference. In allopathy, they used to gaze. Scientific medicine does not gaze. Why not to guess? Because you know you are using law of similars. You know this is the totality of the symptoms of the patient. You know there is totality of the homeopathic medicine similar to that patient's complaint, and you are applying the just law of similars. So here there is no guess. Here you are giving the medicine because you know that medicine will going to work because it is having the both similar presentation. So here there is no question of a gaze. Gaze comes when you think about medicine that it will work. You think there might be a streptococcal infection, let us give this medicine. You think it might be gram negative, let us give metrogyl. This is a speculation. This is not a scientific, this is a gaze. But when you deal with homeopathy, there is no need to gaze. It is fixed. Yes, this is the one side, there is a totality. Effects are there. Just find it out, similar effects in your medicine. No need. This is what is the scientific. And that's why he says scientific medicine does not get. Scientific medicine, like any other scientific art, compares effects, sensations, and motions, and with the corresponding effects, corresponding sensations and motions. We'll finish this sentence only. What do we do when we deal with the patient? We take the whole case. After completing the case, everything detailed, then we form the totality of the case. We find it out that totality, and then we go for comparing it in your materia medica, or either if you have repertorization, you go for repertorization and find it out a similar remedy. So here you compare patient's data, patient's totality with the totality of the medicine which is present in your materia medica. So first thing is comparison, the analysis. Then after analysis, then coming to a conclusion, the evaluation, and reaching to a right simile. The scientific medicine always works with this principle. First it analyzes, then it evaluates, then it compares, and then it reaches to the right conclusion. Homeopathy used to do the same aspect. And this is what he wants to impose on your mind. Your medicine is most scientific because you are using the scientific methods. You are using the scientific experimentation when you are dealing with the homeopathy, and which is not there with the allopathy. You go to any allopath and what do they say? Let us take his opinion. They use the word the opinion. Opinion means gaze, his thought. They never says what science says. There is no science because there is no law. So they always goes on finding it out. We'll take his opinion. We'll take her opinion because it depends upon opinions. It depends upon thoughts. Here in homeopathy, there is no need to take an opinion. Only thing is that to find it out, what are the effects, and find it out right medicine with the help of that effects. Compare it, find it out simillimum, give it to the patient in right potency. So it is most scientific. No need to guess. So this is the difference between two sciences which he tries to impose on your mind, how specific scientific science is homeopathy. So I think we'll stop over here because this paragraph will take another lecture. Here he in detail he explained the scientificity of the homeopathy. Every aspect he has tried to explain the scientificity of homeopathy. So we can go ahead with the help of this in tomorrow's session. There are many students who are there. Amit is there, the Sanjay is there, Nisha is there, Pooja is there, many students. Imam is there, very regular. He is attending the session. Thank you being there. And my suggestion is that Kumud is there. So my suggestion is that all of you, it is the best thing you are learning the Organon, because this Organon, if you learn the 6th edition, you can learn a lot for your practice. And in fact, this James Krauss Introduction gives you a total special thought how to deal with the patients, not with just with a medicine, but with a holistic approach, with the scientific approach, with the management point of view. Everything he defines over there. So we have to learn in this manner the homeopathy. And this series I will going to continue. Ask your friends to join our session so that we can share more. If there are any questions, still there are no questions coming. I expect your questions in my basically in my inbox so that I can answer during the sessions. So if you don't have my mobile number, just add it to your mobile 9890168872. And second important thing, ask your friends to join our YouTube channel, the Divine School of Homeopathy, so that those who have missed the sessions will going to get uploaded over there. But live is live. My suggestion to all of you, you should be alive every time. So if you are there, it gives me a stimulus to teach more and more and to share more and more knowledge with all of you. So it is an active communication when you are there in front of me instead of just on YouTube channel. So thank you being there, and tomorrow I expect that many candidates should take the benefit of this session. Thank you very much and have a good night. Thank you.
Thank you, sir.
Good night, sir.
Good night. Jyoti.